So this is an overview of the Cancer Smart Cancer Champions programme with our key messages there. We've already heard a brief overview of what the Cancer Alliance is, so independent organisation aimed at improving services and care for patients across the whole pathway. And I'm just going to give you a quick overview of the project itself and the key messages. Again, please stop me at any point if you have any questions. So, just to give you an overview of the situation in West Yorkshire and Harrogate as a whole, because that's our patch as a Cancer Alliance, West Yorkshire and Harrogate. Every week in our region, an estimated 250 people are diagnosed with cancer, and sadly 115 people will lose their lives. That's every week because of cancer in West Yorkshire and Harrogate. I just wanted to stay on this statistic for a second because we know from some of the modelling that's been done in the Alliance that there's fewer people on the cancer pathways at the moment than we would expect. So for example, you know, the 2-week wait pathway, which is the kind of urgent cancer pathway that you would go onto if you see a GP, for example, who suspects that your symptoms could possibly be cancer. And so they send you through an urgent referral. So there's fewer patients on those pathways than we would expect. We're not 100% sure why. There could be lots of different factors there, but that statistic kind of makes what we're doing all the more important, because there could potentially be people out there in our community that are sat on symptoms that could potentially be cancer that aren't going forward to their GP or seeking medical help for whatever reason. And then the next is that some groups nationally tend to have worse outcomes from cancer. This we term inequalities. And when I'm talking about inequalities, what I mean here is health inequalities, which are defined as unfair and avoidable differences in health across and within populations. And there's some groups within populations nationally that have unfair and avoidable differences in health. And this is the same for cancer as well. So for example, there's certain groups that tend to access cancer services less, they tend to be diagnosed late, and their outcomes tend to be worse. For example, they don't take up offers of health and wellbeing support as much as other populations. They don't access their screening. And these populations are listed below, and this isn't specific to West Yorkshire and Harrogate. They're the same populations that experience health inequalities in cancer nationally. And these are people that live in more deprived communities, BAME groups, or essentially anybody who isn't white British, people living with mental illness, people living with physical disabilities and learning disabilities, and also trans and gender diverse populations. So just to mention those, as these are potentially the populations that we want to get these messages out to most importantly, perhaps going forward. So next, I just wanted to give you a brief overview of the project as a whole and where you guys fit into that as digital champions. So we're recruiting 3 different cohorts of people. The middle ones are yourselves there, the digital champions, who are going to help us and already have been helping us share positive health messages on social media with your networks to promote things such as smoking cessation and breast checks, which is a few of the things that we've already been promoting. And there's 2 other cohorts of people. So the one on the left is the main sort of cancer champions, and they all have a big role in deciding where the project's going to go on the training programme that we offer our champions, for example. And there's also going to be the community connectors, who we envisage as people who are more physically present in their communities, whether that be faith groups, people in voluntary and community organisations, hairdressers, physios, beauty therapists, people that work in bingo halls. The possibilities are endless there. And we haven't recruited yet for the last 2 that I've just mentioned. We decided to go with the digital champions first because of the current situation of the pandemic. People were a lot more digitally engaged than they were perhaps before. And just to emphasise as well, if the roles aren't mutually exclusive, so if you'd like to have more than one role, that's absolutely fine. And just keep an eye out for the recruitment materials, because we will be recruiting for those volunteers over the next couple of weeks. We've already had a couple of digital champions who are active, for example, in residents associations at central sheltered housing and Rotary clubs, who've offered to be or talked about ways in which they could do community connector roles. So that's just another example of how you could get more involved if you wanted to. And now I'm just going to give a brief overview of what cancer is. Most of you probably already know, as there's some personal experiences of cancer here, but I'll just give a very brief overview, and then I'll go into the 3 key messages here, the 5 key messages that we've got here. So what actually is cancer? So very briefly, the main statistic is that 1 in 2 people in their lifetime will be affected by cancer in some way. And what cancer actually physically is when our own body cells change, so become abnormal in whatever way, and then start to multiply out of control. And you can see the little infographic there on the top right from Cancer Research UK. Usually they form a lump of tissue or a tumour, which is often called the primary in medical speak. And these abnormal cells can spread to other parts of the body and form lumps, for example, in other parts of the body, or metastasise. And this can either be called a secondary or a metastasis. And the symptoms of the cancer depend on what type of cells become abnormal in what way, and whereabouts in the body the cancer is. And the second infographic there on the right hand side is just points out the main locations of where a metastasis or a secondary could be. So there's brain, lung, bone and liver, and then the lymph nodes are there, which are they're kind of involved in fluid regulation of your body in a way. So they have a role in removing fluids or plasma from each of your organs. So lymph nodes is on there because often, because of their physiological role, that is where the cancer cells can spread to first, which is why often if you have personal or family friends experiences of cancer, they'll often mention whether there was lymph node involvement. So just to point that out as well. Does anyone have any questions at this point? No. Okay. So I'll just move on to the key messages now. There's 5 here. So one of them is around screening, making it cancer an everyday conversation, awareness of unusual and persistent changes, so symptoms of cancer, reducing risk with a healthy, active lifestyle, so prevention of cancer, but also living well with cancer, and most importantly, taking action now. So firstly, I'll give a brief overview of the cancer screening programmes, of which there are 3 at the moment in the UK. So the first one is bowel. So people will receive a fit kit in the post 2 yearly between the ages of 60 and 74. And an image of the kits is just the first on the right there. And you basically take a very small sample of your poo, pop it in an envelope and send it back off to the screening hub. This has recently changed from, so the old kits you used to have to do 3 samples of your poo, whereas now it's just 1. So we're hoping that bowel screening it will be a lot, because it's a lot more acceptable to patients. There'll be a lot more people taking part in it, which is really positive. And it's estimated to save about 2,500 lives a year in the UK, which is excellent. Breast screening is a 3-yearly mammogram for people that have breasts between the ages of 50 and 70. There has been, because of the pandemic, there has been some changes in the breast screening programme. So you can see there, they're wearing masks in the picture, they clean the equipment in between use. And breast screening is estimated to save about 1,700 lives per year, so lots of people, which is excellent. And then the cervical screening test, which is traditionally called the smear test, either 3 yearly or 5 yearly, depending on your age group. And this is estimated to save about 5,000 lives a year across the UK, which is staggering and incredibly impressive. But all the more important when you take into account the fact that uptake of cervical screening, so the amount of people that are invited to screening that actually go for screening, is falling, especially in that younger age group, 25 to 49. So we're working on a number of ways to target those age groups for cervical screening. To give you a brief update, because of the pandemic, so all 3 of the screening programmes either paused or had significantly reduced capacity during the first wave, but they're all now back up and running throughout the entire region of West Yorkshire and Harrogate, although somewhat reduced capacity. So just to give you that update as well, so if we're asking you at any point to increase to promote screening uptake, we wouldn't be doing that if there wasn't the capacity further down the line. So just to give you the reassurance there, that patients will be starting to get the letters again for the screening that they're entitled to and that could potentially save their life. So we'll probably be asking you to share some screening related messages at some point. And just to make the big point as well, that screening can actually prevent cancer. So it's not just a way to detect it in its early stages. They can detect different types of abnormal tissue that aren't going to become cancer, but are more likely to become cancer than other cells. And those parts can be removed. So just to make the point that screening can actually prevent cancer, it can stop you from getting it, which is a really important point I think is often missed in screening promotion. The next key messages that we're going to dive into now is making cancer an everyday conversation. We want to empower our champions, all 3 cohorts, to be able to have conversations with their peers, friends, colleagues about cancer. And one of the ways you can do this is by becoming a digital champion. So welcome to our new digital champions. You can help diagnose more cancers early and potentially save lives by encouraging people to become more aware of cancer symptoms and unusual body changes. So for example, the breast cancer materials that we've been asking to share in the Facebook group are all around kind of breast checks and things like that. Helping people feel more encouraged to attend their screening, be better informed about ways to reduce their cancer risk and live more healthier lives with cancer. And most importantly, perhaps know where to get information and support from a reliable and trusted sources. And we wanted to have a think about, because we knew what we were wanting to ask from you as digital champions, but what can we do for you and what benefits does it have? So aside from working with us in the Cancer Alliance and from working with the regional charity Yorkshire Cancer Community, we're trying to build a database of other courses that you could do if you wanted to further increase your skills. So there's a couple that I've come across already. So there is a very brief advice training for smoking cessation that's on offer regionally. And another one that we found that I've linked to in the presentation, and we can give you the link to the presentation after I finish today, is a course aimed at the public by Cancer Research UK that I think it takes about 3 to 4 hours to complete. It's online and it basically empowers you to be able to have those conversations around cancer with the people around you. So that's just 2 examples of the additional support and sort of skills building that we wanted to offer you if you wanted to take that up. But again, just devoting those few minutes a week to sharing those positive cancer messages, if that's all you wanted to do, that's again absolutely fine. But we wanted to emphasise what further benefits could be for you if that was something that you wanted to do. So awareness of unusual and persistent changes, so symptoms and signs of cancer. Why is diagnosing cancer so early so important? And it's because when a tumour is smaller or where the cancer is in fewer places, which basically means when it's at an earlier stage, treatment's more likely to be successful. And if more cancers were diagnosed in the earlier stages, 27 lives could be saved every day and 10,000 per year in the UK by diagnosing cancers early. 27 lives every single day, which is really impressive and something we should really be working hard to achieve. And one of the ways that services and academics measure cancer outcomes is looking at 5-year survival, which is the chances of that person with cancer still being alive after 5 years. And that can be 3 times higher if that person is diagnosed at an early stage compared to later, although this does vary depending on the type of cancer. So for bowel cancer, if it's diagnosed in the early stages, that person is 90% likely to be still alive in 5 years compared to 14 at late stage. For breast, it's 90% in early stage compared to 15 at late stage. Lung is 80% again compared to 15. So the important message here is, as champions, encouraging people or empowering people to act now against cancer and make that GP appointment. It could be the crucial step in helping them achieve an early cancer diagnosis. And having better outcomes. You could potentially save someone's life with the messages that we're asking you to share here. So what are the symptoms of cancer? I just got these off the top of my head, all the different cancers I could think of and all the symptoms that could potentially be cancer. Chances are that these things are all benign and are treatable and nothing serious, but there's also a very small chance that any of them could be cancer. But to emphasise here, knowing all the symptoms of all the cancers is not your role as digital champions. That's the role of the medics and the cancer specialists. The messages that we want you to be able to spread are that if it's persistent, unexplained or unusual for you, just contact your GP. Again, chances are that it's nothing serious. Chances are that it's treatable, but just go and see your GP and they can refer you on for further investigation if they think it's needed. Next, we're moving on to reducing your risk with a healthy, active lifestyle or doing things to prevent cancer or ways to live well with cancer. So the 4 in 10 cancer cases can be prevented, which is a huge amount, and perhaps no surprise, the biggest risk factor for cancer is smoking, which has been linked to 16 different types of cancer, so not just lung cancer. Smoking and nicotine addiction is something that we really need to help people beat. Smoking and being addicted to nicotine will kill 1 in 2 people eventually, and for every 1 person that dies because of smoking, another 30 will have long-term condition directly because of smoking, whether that be COPD, emphysema, or whether it's related to the effect that smoking has on your arteries. So if it affects the arteries to your heart, that can cause angina or heart attack. If it's the arteries that lead to your brain, you can have strokes and mini strokes. It can hasten dementia. If it's the arteries that lead to your limbs, you can get claudication, eventually leading to amputations. If it's the arteries that lead to your genitals, it can cause erectile dysfunction. If it's the one that leads to your kidneys, you can get kidney problems. I'll stop there, but basically smoking is one of the things that we really need to prioritise in terms of cancer prevention, and also helping people who already have cancer live healthier lives. And thanks to everybody so far that shared the Stoptober messages on the Facebook group. Just to give you a bit of encouragement after all that doom and gloom, there's been some research or some statistics, come out by an organisation called ASH, saying that throughout the pandemic, 150,000 people across Yorkshire and Humber tried to quit smoking, and 92,000 succeeded across Yorkshire and Humber. So that's amazing. And that was off the back of the Quit for COVID campaign that they were running, which is now the Stoptober is kind of piggybacking off of, trying to keep that momentum going. So that's excellent. 92,000 people across the region have managed to successfully quit. So the next one down is being a healthy weight. So it's known that people of higher BMI are increased risk of cancers, and the risk is worse the more overweight you are and the longer that you're overweight. The mechanisms aren't completely understood, but it's to do with the effects that fat cells or adipose tissue has on your body in terms of the chemicals that they secrete, and how they kind of behave and how your body reacts to it. It's a risk factor for some of the most common cancers, so breast and bowel, also womb, esophagus, liver cancer, also some of the more harder to treat cancers such as pancreatic cancer. So that is a big one, and the unhealthy weight messaging often gets kind of diluted in the smoking cessation messaging. So just to make the point that unhealthy weight is a big risk factor for cancer too. UV and skin cancer, so there's one that says be safe in the sun. Getting sunburn once every 2 years can triple your risk of melanoma, which I didn't realise till I was researching for this presentation, which is quite staggering. Melanoma being the most serious skin cancer, so we'll probably be sharing some be safe in the sun messages later this year, well probably early next year, for when there's actually some sun for us to protect ourselves against. And then the last one I just want to draw attention to is the one that says protect against certain infections. HPV is mentioned there. So for those that don't know, HPV is a group of viruses that can cause genital warts and also increase the risk of numerous genital cancers. So not just cervical cancer, it can also increase your risk of vulval cancer, vaginal cancer, penile cancer, anal cancer, also throat cancer. And at the moment in the UK, we have a vaccination against the 4 types of HPV that are most likely to cause cancer. It's given to 12 and 13-year-olds, so people in year 8, and also men who have sex with men. There's a study looking at this vaccine in a few different countries where it's part of their schedule, and it was shown to reduce HPV infections in young people by around 70%, reduce cancerous cells, precancerous cells, by 50%, and reduce the risk of developing cervical cancer by 53%. I think that's absolutely amazing, and also just a bit kind of mind-blowing that we actually have a vaccine against cancer, which I think is absolutely incredible. So we'll probably again be sharing later this year, early next year, some messages around promoting the uptake of the HPV vaccine. So finally, so the last message is take an action now against cancer, and that's kind of directed at you as digital champions in terms of continuing to share those positive health messages, but also to the people that you're communicating with in your networks and communities. Just a reminder to only share what we provide via the Facebook group, because we make sure we pick out not only the most effective messaging, but also from the most sort of trusted and reliable sources. So for using kind of Cancer Research UK, NHS, different sources like that. And I know that some of you already shared some of the Stoptober resources there, that blue picture. And also just to make you aware that we've been sharing, you probably already know, because it's Breast Cancer Awareness Month this month, and that's just an image from the campaign earlier this year. And this is especially important because you may have seen in the media, there's been that statistic going around that 1 million women have either missed or been delayed their breast screening because of the pandemic. So this kind of makes all the messaging around checking your breasts and being aware of your body, all the more important, because if 1 million women have missed out on their screening, there's potentially going to be some women out there who have early cancers that haven't been picked up yet on screening, and that potentially could become lumps that they could feel or otherwise symptomatic, that they need to feel enabled and empowered to go and see the GP about, to get on those right pathways to get a diagnosis. And then finally, in terms of troubleshooting, if someone comments or is in an abusive way or is abusive from your posts, the best thing to do is just report it as per the Facebook guidance. If you have any further issues or you want any more support, feel free to email me, Jill, or Tracy. And also, what if someone asks a question I can't answer or is confrontational? What if someone's posting misinformation or facts that you're not sure if they're true? The best website to point them towards is always the Cancer Research UK website. There's plenty of stuff on there. Or if you're still stuck, just email me, Jill or Tracy. We're happy to help. We do like people to kind of debate things and have discussions on your posts. That's what we want to do. We want to make cancer an everyday conversation and get people talking about these issues. But again, if you think there's anything that's false or potentially misinformation or aggressive, just contact us and we're happy to help there.